So an incident which tells you how desperate the times that we are living in, where relatives, those who have lost their loved one, just took out their anger on the property of the hospital and also on the doctors, those who were desperately not only trying to save their patient but others as well. I'm now being joined at the Apollo Hospital by Dr. Karan. He is Vice President at the communications team. We also have Dr. Priya. She's the head of the emergency services here at the Apollo Hospital. Ma'am, I first want to understand from you, if you could tell us what happened, and it just happened behind us at this emergency, station of yours, workstation of yours. Why was it that the patient suddenly, the attendants just attacked the entire staff?
So this patient had come in the morning and she was very critically ill, as are most patients who are coming in, because they're coming in very late. And she was an 80-year-old lady, and unfortunately she couldn't make it. And of course, as the psychology, they were stressed or, they were angry. It always has to come out on the doctors and nurses who are actually trying to take care of the patient, and they just went all over the place and they attacked, and they broke things, they broke the glasses, and it's it's very, very unfortunate, because here we are really trying our best, all of us are, and unfortunately it's always the person who's trying to help is the one who seems to be told that you're not doing enough. I know everybody is stressed, everybody is with their loved ones, they're trying to take care of them, they're trying to save them. The situation is unprecedented, where every hospital seems to be full, but please try and understand that we are trying our best, and you cannot be accusing the people who are trying to save you. Please understand that.
No, I can still see the marks that you have had because of the glasses and the protective gear that you have to wear. How's your staff doing? How many people are injured?
So unfortunately it was, they are okay, and it is like we are supposed to be very resilient, and we are. We have bounced back. Everybody is back to work, and they are looking after the very next patient who comes in with as much of enthusiasm that they were earlier. But it takes a toll on your emotion. It takes a toll on your morale. And you have to understand. I know maybe I'm asking for too much, but one just has to understand that we are trying to do our best.
As you were saying that it does take a some sort of a toll on your morale as well. What did you say after this to your staff? I mean, it's a very, I can't understand the feeling where you are threatened at your own workspace. I mean, what did you say to your staff so that they could just go back doing exactly what they have been doing under these trying circumstances?
So fortunately, we have a set of really fantastic doctors and nurses, and we just did a little quick huddle, and management was very supportive, and they came in, and everybody was here, the security, everybody was here. And we said that we just have to move on, because if one person's relatives behave like the way that they did, we can't let other people suffer. This is our profession, but it cannot be taken for granted every time.
What would you, as I've been going hospital after hospital where people are very, very desperate. There are hospitals which are completely overstretched. Doctors are anyway overburdened. But so are the people, because they're very desperate. They are not getting the facilities, that they possibly would in normal circumstances. As a doctor right now, what would you like to say to those who are in fact, almost at their wits' end? They just don't know what to do, and their all hopes are on the doctors, but also the anger if you're not able to save their patients.
Yes, so for that I would say that please, when you start your symptoms, anybody in your family is starting their symptoms, you need to at that time seek medical help and not wait for very late, because at that time really nobody is going to be able to help you. You're expecting a miracle, and that is not going to be possible. Everybody is working as much as possible, and medically, I mean, science and whatever research there is, it can help only if you're getting treatment on time, not when you wait so late that everybody, is coming already with oxygen on them. By the time they get to the first hospital, before that they're at home. Some of them don't even get medical help. Some of them don't even get tested. So all of that also needs to happen. It's just not that, everything is not done and then the doctor is expected to do a miracle. That's not possible.
How many hours are you pulling every day?
I don't even know. I don't even know, because, one works and then you're working on the phone, then you're coordinating. So it just goes on and on. But yes, we will do whatever we can to, make sure that we can save as many lives as possible.
There are no words to express the gratitude or the appreciation of the people, and this is very, very unfortunate. Dr. Karan, you said that because of what happened, the services were also hampered for some time. So this also has, for other patients, a lot of inconvenience. I mean, the help that they deserve at that moment possibly is delayed because of the kind of incident that took place.
That's right, Ankit. First of all, our deepest condolences to the family. Any life lost is a deeply tragic incident to have happened. But I would also like to urge all countrymen today to back doctors and healthcare workers. We need your support the most. We are all in this together. Because of an incident that happened today, a devastating incident maybe for one person's life, should not come in the way of, spoiling the chances of access to care for other patients. Today we had that. There was some bits of vandalism, some destruction of property, and because of that we had to shut down parts of our services for some period of time before we restarted them. So it is our humble appeal to please support us, to support doctors and frontline workers so that we can continue to give this care. We are still a long way off from seeing this through. So we all need to stick this, be together and stick this one out together.